I was married to my high school sweetheart for 27 years. He was the life of every party. When Shane was 51 years old, he was diagnosed with stage 4 colon cancer. It spread to his bones, and the doctors told us that there really were no other viable treatment options available to us, and that we needed to think about hospice.
Hospice is a service that is provided in the continuum of care for a patient with a terminal illness.
Hospice is the way that healthcare should be.
We don't just treat end of life with the elderly, but we see children, we see teenagers, we see middle-aged people.
Anything that's needed at the end of life for that patient.
My father was a caregiver for my mom who had dementia for many years, and it was just becoming too much for him. Hospice stepped in and provided a lot of the daily needs that were important, not only for my mom, but also for my dad.
Approximately a year ago, my wife got sick. I asked LaDonna if she wanted to do more tests and more work, or did she want to go home. I was tickled when she said, "Take me home."
Just the way that everybody's life is different, everybody's death is different too. And we want to make that something that the family will remember and look back and know that this is what they would have wanted.
Shane talked to me about wanting to go into hospice more, and I was still in denial that we were there. He said, "I don't know why you won't put me in hospice. I don't want to die in pain." And he said, "I need them to come." And so I called, and they were just like miracle workers. I think if I would have fully known what all they could provide and how wonderful that team was, we would have done it a lot sooner.
She always wanted to look beautiful. They would put lotion on her, take care of her hair, paint her nails.
I guess as a caregiver, I didn't have a clue what I was getting into. But as a caregiver, plump, you're there.
We have nurses and chaplains and social workers and aides, and every person going into that home gets to know a different aspect of that patient.
You hear all the family stories and their life stories.
You get to build relationships with patients and their families.
When Julie Didier would come to our house, he would just light up because it was his nurse, he knew. And for me, it was like she was a lifeline because I knew now I had someone I could call 24/7.
Richard Carr was the hospice chaplain at the time. Richard truly cared about Mom and Dad. He was wonderful.
Going on hospice is not choosing a fast track to the end of the race, but it's choosing a more comfortable path for the journey.
Cannot say I've got any regrets at all. We were so blessed. I'm lonely up here, but I have peace down here. So that I feel is a part of the professional help that I got from the hospital staff and hospice.
After the death of the patient, we continue to follow the family members with booklets that we get through the foundation. People are always telling us they know exactly what I'm talking about in this booklet.
It's touching to know that it didn't end at her death. The care was still there. The support was still there.
Even a year and a half later, they're still there for us. So it's been wonderful.
The foundation really exists to help our donors create a better patient experience. We are always so thankful that you are here to support us in so many different ways. And this is just another way that we can help patients on that continuum of care to have a better quality of life.